Thinking about a tummy tuck, but worried about drains? You've heard all the buzz about drainless tummy tucks and faster recovery. Today, I'm going to break down what the terms mean, who qualifies, and how I can help pick the right plan for a smooth, safe result for you.
Welcome to Plastic Surgery TNA. Talk and advice with Dr. Earl Stephenson, board certified plastic surgeon and facial aesthetic expert. Real talk, real results, real transformations. Let's dive in.
I'm Dr. Earl Stephenson Jr., board certified plastic surgeon in Atlanta. This is Plastic Surgery TNA, that's talking advice where confidence takes shape. If you're here and you're new, hit subscribe and ring the bell so you'll never miss an episode. So let's get into it. Let's start at the foundation. Let's just simply go over briefly what is a tummy tuck. A tummy tuck is a body contouring procedure that requires removal of excess skin, fat, repair of stretch muscles for a redefined waistline. There are different types. Everybody has a little bit of a marketing twist to it, but typically there's a mini tummy tuck, which basically is a smaller, limited incision below the belly button, kind of near the mons or the girdle, that takes care of a very small area just below the belly, just a little pooch. There's a full tummy tuck, which is kind of the standard, which the incision is low, just above the girdle, but goes basically from hip bone to hip bone. This is your standard type of tummy tuck, which allows me to lift up the skin, address the muscle, remove any excess skin, reposition the belly button, liposuction for a final contour, and that's a standard full tummy tuck. Then oftentimes you may have to go to an extended tummy tuck, which is our third variation, which is the same as the full or the traditional, but it's just the incision rides a little bit further back toward the buttocks so you can really shape the flanks. When people, men or women, have really full flanks, sometimes liposuction alone won't be the answer. So you have to remove some skin and fat there as well. So we remove skin and fat, we repair the muscle, redefine the waistline, typically with that plus liposuction. The reality is, when I'm doing all this, when plastic surgeons are doing this, we're basically lifting up the skin much like a hood of a car, and we're seeing what's underneath, which is the muscle. We're doing all the things that I've talked about. And then we're removing the skin and putting this back down, like putting down the hood of a car. The space that's created by that procedure is a potential space, meaning that it's not immediately stuck back down to you, to your core right after surgery. That means something can occupy that space, and something usually is a fluid collection. Most often, this is called a seroma. And everybody produces seromatous type fluid after an operation, especially a tummy tuck. It is a natural portion of the healing process. But sometimes that seroma or that fluid collection can overwhelm the body, and the body can't soak it up as quickly or as readily, and that collects underneath the skin, giving you contour abnormalities and bulges that feel soft. So, this is where the term drain or drainless, or the conversation, should I say, is really had. Should I put a drain? Should I use a drainless technique? What is the best thing to do? So let's pivot to what drains are. Drains are typically made of silicone. They're soft tubes, typically round, that are connected to bulbs on the outside that gently help remove fluid from beneath that space, that's the space underneath the skin that we've lifted up and contour and placed back down. It can also, just as an advantage, help remove any bleeding that may occur underneath the skin, which is called a hematoma. But it's not the sole treatment for hematoma. Hematoma may represent an active bleed, and you often have to address that in surgery by searching for that bleed or bleeding, making sure that that bleeding is stopped. And then a drain is placed as a extra measure of safety and security in case there's some ongoing oozing. But we're going to shift really and focus on seroma because that's the topic of the day and why it ties into having a drainless tummy tuck or a traditional drain tummy tuck. So, the pros of having a drain, it's really reliable. You can use this to remove fluid in what I call riskier cases. These are patients or clients with high BMIs, and a lot of people do high BMI surgery. I don't particularly. I like to keep my clients at a BMI of 34 or under. I've done that for many, many, many years and had outstanding outcomes with, I believe, not any increase in any complications. So, but people who are doing high BMI surgery, certainly a drain is a very reliable way to manage that fluid. If you're going to really get underneath the skin and really open up that area so you can see widely, called wide undermining, meaning you're under the skin and you're just kind of under the skin and kind of exposing things. So it's undermining. That produces a larger space. So you have more tendency to collect fluid. So again, a drain is advantageous in that scenario. And people who've had massive weight loss have a tendency, and I'm not quite sure why, they tend to produce more fluid even though they've lost their weight. At or near their ideal body weight, tend to seem to form more fluid. And so a drain, I think, is really advantageous in that client population. It provides clear, objective tracking. You can tell if the fluid is coming out, the consistency of it. Is it dark red? Is it pink? Is it Kool-Aid flavor? Is it pale yellow? You can determine the amount. Is it decreasing each day? Is it increasing each day? So it's a clear and objective way to track the nature of the fluid and the consistency and amount of the fluid. So those are the pros. Cons or disadvantages, it's a pain in the ass. You have to empty it twice a day, or your surgeon may tell you 3 times a day. You have to write down how much fluid comes out each time. When you try to sleep, it gets tangled up. It gives you fits during sleep. You may actually pull it during sleep, which can be painful. There's a small risk that you can have irritation at the exit point of the drain out of the skin, or even a small, what we call entry site infection. Rare, but can occur. They usually stay in place for about 7 to 14 days. I typically try to take my drains out in about 7 to 10 days, depending on the nature of the fluid coming out. I like it to be either Kool-Aid flavored, Kool-Aid, I'm not drinking it, Kool-Aid colored or clear pale yellow. And I like the output for an entire day or two to be less than 20 cc, so less than maybe a tablespoon, or excuse me, a little more than a tablespoon. So that's my criteria. Every surgeon has their criteria. So let's now switch to drainless. So what is drainless tummy tuck? Obviously, we're not using a drain. So what do you do to minimize the chance of a seroma? It's not a magic trick. We typically employ a technique called progressive tension sutures, or PTS. These are kind of quilting sutures. If you've seen furniture, and we all have, that have the little buttons and they are quilted. It's basically the same concept. You lift up the skin, you do your muscle work, you do your contouring with lipo, you remove the excess. Instead of just putting the skin back down and not placing a drain, we progressively pull the skin down, and we put anchoring sutures as we pull down towards the girdle or the pubis. This also gives us a little more skin to remove. It quilts and seals that space more firmly so it minimize the amount of room that fluid can form or smaller amounts can be formed and the body can manage that better. What are the pros of that or the advantages? Of course, there's no drain, so you can move around readily, more comfortable. Uh, it feels better overall. Daily activities like showering, putting on clothes, and sleeping are much simpler. Considerations, I wouldn't call them disadvantages, but considerations. It may take just a little bit more time in surgery to perform this maneuver because it's a bit meticulous to kind of march down from the breastbone all the way down to the pubis by putting these quilting sutures at various levels down toward the pubis so that you can essentially try to seal off that space as much as possible without creating peculiar contours or having uneven amounts of skin come down so that your results can be compromised. So it takes a bit more of a discerning eye. It takes a little bit more patience because it is a meticulous technique and it depends on your surgeon's experience, the complexity of the case, as to how long or how much longer it will actually take. And that varies from surgeon to surgeon, depending on, again, the complexity of the case and regardless of the surgeon's experience. Another consideration is you can have the best of both worlds. You don't have to have either a drain or no drain. You can have PTS, progressive tension sutures, drainless, with one drain. Typically, I put two drains in if you're of normal size. If you're super petite, maybe we can get away with one without progressive tension sutures. But if we're using progressive tension sutures, drainless technique, and I'm still a little unsure that the body may be able to manage the fluid, even though we've limited the space. I'll put one drain in. So that's belt and suspenders. We're going above and beyond to make sure that you have a great outcome and a safe outcome. So the hybrid plan is certainly something to consider. Having said all this, what's the literature? What's the science tell us? Using PTS or quilting sutures, the seroma rate is at worst comparable to a drain, but often better than traditional drain only approaches. That's what the science tells us. I can only speak to my practice. I just feel that adding a drain doesn't hurt you. It can only help you. Yes, it's a pain in the butt, but it's better than having a seroma, whether it's small or large, whether it's small because you use progressive tension sutures or quilting, or whether it's large because you didn't use a drain and didn't use those sutures. It's a pain in the butt to come in and have a seroma and treat it. Because what often happens is that you'll recognize it and you'll numb the area up, you'll draw the fluid out, you'll ask your client to reduce their activity because you don't want a lot of movement of the skin. You'll make sure their compression garment or their faja is really tight or compressive but not restrictive. And so that you can close down that space and prevent that fluid from reoccurring. It typically reoccurs. So you're back again in a couple of days or next week. And if this gets away from you, you're back week after week draining fluid, and that gets tiring for everybody, for the patient and for the doctor and for the staff. And you run the risk after this has happened week after week after week after week. The body's just producing this fluid and it's just not turning it off. The body just decides, I can't soak it up. So I'll just kind of wall it off. So underneath the skin, it'll develop a rind and it'll just enclose this fluid with a little bit of scar tissue. And now you got a fluid filled cavity. So now what do you have to do? You might have to go back to surgery and take that Ryan out and put down the PTS sutures and another drain. And so it eats up more time. It delays recovery. It doesn't allow you to get back to your life. So I don't think adding a drain is a detriment overall, in my opinion. So we want to make sure that we're doing the safest things. Quilting sutures alone, and some surgeons are staunch advocates of quilting sutures and drainless tummy tuck techniques alone, and that's fine. Again, I just don't think a drain hurts, but that's fine if that's what they want to do and they have experience in the outcomes with that technique and feel comfortable choosing that technique in the for the right client. That's what it's all about. You've got to marry the right technique, the right surgery with the right client for the best outcome. So if they feel comfortable with that, that's great. I just don't feel comfortable with that. Again, I just don't think it hurts in the big picture to add a drain. So the biggest determinants of if you're going to produce fluid, undermining or lifting up the skin and really kind of opening up the area underneath the skin greatly. High BMI patients, prior surgeries because it just takes longer to get through the scar tissue, which tends to increase inflammation and to increase potentially more fluid after this is all said and done. Aftercare behavior such as increased activity, uh, hydration, poor protein intake can increase um, fluid accumulation. So again, quilting sutures alone have comparable rates of seroma at worst, but tend to be lower in in the production of seromas or minimize the production of seromas a little better than drain only techniques. That's what the literature said. In real life, I'm using a drain either with PTS sutures or without. So, having said that, who is a good candidate for drainless technique? A non-smoker, and I think a non-smoker is it's across the board. Whether you're getting a drain or not, you can't be a smoker because it tends to put the your overall system body in a state of inflammation. It certainly can cut down on the blood flow, which can lead to other problems such as skin loss, etc. So we definitely want to choose tummy tuck procedures, drainless or with a traditional drain on non-smokers. You've got to have a stable BMI, and every surgeon has their BMI, high BMI cutoff, whether that's 40, whether that's 28, whether that's 30. And for me, 34, every surgeon is different, and their reasons why they stop there and don't go above are different. So you just have to talk to your individual surgeon about that. If you have, not a lot of skin, meaning that you're not a high BMI patient, then a drainless technique may be good for you. If you got a straightforward muscle repair where you just tighten the muscle from kind of stem to stern, then you might be a candidate. If there's limited undermining, you just lift the hood a little bit and you don't lift it all the way up or widely, then you probably are a reasonable candidate for a drainless tummy tuck technique only, and that you or the surgeon kind of has a good feel that you're going to be super compliant, almost hyper vigilant about wearing compression, modest activity, and for follow ups and following post operative or aftercare instructions. People that or clients that best benefit from a drain are massive weight loss patients, people with high BMIs, people where you have to open the hood widely and kind of get enough to get underneath and see widely. So extensive undermining, people who have revision or repeat tummy tuck or abdominoplasty. Sometimes some surgeons, plastic surgeons, will do complex hernia repair underneath this, or combine with their general surgery colleagues. They will do that. So a drain is most likely necessary in those cases. Combine procedures. Maybe you're doing mommy makeover, and you're doing the tummy tuck with that. So a drain might be a good thing to use during that particular combination procedure. Prolong that, and the reason because you have increased operating room time, so the tissues are exposed to the outside environment for a longer period of times, which tends to increase inflammation and produce more fluid. And if you have kind of, I guess, bleeding risks, certainly you don't want to put someone under anesthesia and perform a tummy tuck if they are high risk for bleeding. But if you feel that, this is a little bit more oozy than I thought it would be, and you've done all the other things to help dry up or minimize bleeding, a drain is certainly a reasonable thing, one or two to be placed after surgery. Again, if you want to use progressive tension sutures in addition to that, that's not a bad thing. If you just want to do just a traditional drain only, that's perfectly fine. So those are the candidates for drains or a hybrid approach. So we're moving to recovery. Recovery, comfort, and compression. That's where we're going to go with this. What are the plans for drains if you put a drain in? Typically, you measure the output twice a day, morning and the evening. Again, every situation, every client's different, every operation is different. So your surgeon may tell you something different that is particular to your situation. You want to get up and move day one. This helps mobilize fluid. So that will be helpful. You typically can shower with the drains in about 48 to 72 hours. Yes, you can shower with the drains. Uh, you're able to basically remove the drains. As I mentioned earlier, I lost my train of thought. Remove the drains in about 7 to 14 days when the output is consistently low. For me, that's 20 cc's or a little greater than a tablespoon. I keep saying greater, a little less than a tablespoon. So I think a tablespoon is actually 30 cc's, a little less than tablespoon uh, over a couple of days. Drainless, the plan for recovery, comfort, and compression is similar milestones to people with drains. Of course, compression is a key component in both. You want to you don't have to measure anything because there are no drains. You definitely want to walk day one. You typically can shower at 48 to 72 hours, but strict compression is required. Again, hypervigilant because now we don't have a drain as a extra measure to kind of help manage fluid. We're depending on quilting everything down and your body resorbing any smaller fluid pockets that may develop. So we don't want to be running around, ripping and roaring and moving that skin around, creating friction and creating more inflammation and creating more fluid production. So compression. You want to make sure that you have a protein rich diet. If you lack protein and you lose protein in your blood system, then the fluid that's in your blood system wants to ooze out into the tissue, which can produce more fluid. So we want to make sure we keep our proteins rich nutrition up. We want to make sure we stay hydrated. We want to avoid heavy lifting. We want to avoid nausea, which can be retching, which can cause shearing. So again, we really have to be diligent about our recovery, comfort, and compression. It's important in both. Certainly, if you do a drainless tummy tuck technique, it's really, really important. All right, kind of moving toward the end and winding it down. There are a couple of myths that people have about this subject. First myth: drainless tummy tucks heal faster. Yes or no? Well, it feels like it's easier, so therefore it feels like it's faster. But healing is really based on biology and behavior. If you're non-compliant, then drainless tummy tucks are not going to heal faster. You'll have seromas and you'll have to be treated and you'll be back to the office multiple times to get that drain. So it's really biology and behavior. So they don't really heal faster, but if you're compliant, it's definitely feels easier. The next myth, all drainless tummy tucks are the same. That's not true. It depends on your surgeon, depends on the technique of progressive tension sutures that you use, how many, how little, and your anatomy. Some surgeons just use a few here and there. Some surgeons are very ordered and they have so many per row and they go down, to from pubis, I mean, excuse me, from breastbone to pubis in a very measured numerical pattern. And they don't really deviate much from that. And some people just depend again, some surgeons just look at the situation and say, this is what I need. This is where I need the progressive tension suture here, here, and here. And that varies from patient to patient. So not all drainless tummy tucks are the same. Last myth, because your plastic surgeon doesn't do a drainless tummy tuck, doesn't seem to be cool or on the cutting edge, and uses a drain means that he or she is a bad surgeon. Absolutely false. Drains are a tool and it's part of a plan, and a plan is customized to you. The risk that I hate to say you pose, but the risk for your particular operation based on your anatomy and based on your physical examination and situation and what we're trying to correct, and based on your goals. So just because somebody uses a drain or chooses to do that doesn't mean they're a bad surgeon. So, how do you make the decision? Again, I think I kind of touched on this here and there. How do you make that decision? It's based on your anatomy and your goals, what the surgeon sees in surgery real time, putting together with your risk profile. Did you have a massive weight loss? So you probably might need a drain. Are you kind of a high BMI? You might need a drain. Did I not do a lot of undermining? Or I lifted the hood up very slightly. Maybe you don't need a drain. Maybe you can just go with progressive tension sutures. So anatomy, goals, findings in surgery, and your risk profile equal your plan. So that's how we come up with the decision: drain, no drain, or drain and a hybrid plan, or a hybrid plan. If you're considering a tummy tuck and you're really ready to move forward and you choose a couple of surgeons to have a consultation with, these are a couple of, I think, key questions to ask in regard to: does your surgeon use a drain or does he or she not? The first question asks, what technique do you use to prevent seromas? And that may be multiple answers to that question. What you're trying to find out, obviously, do they use a drain or not? Why, of course. And, the surgeon will give you their reasons why they use a drain, why they don't use a drain, and what added measures, if any, are also employed to help prevent fluid collection or seromas. The second question you ask or should ask: what are if I'm the patient, what are my individual risk factors for needing a drain or not needing a drain? So you got to ask that. The third question is, what does my recovery look like with or without drains? And your surgeon, again, should be able to just run down that very simply with you. If a seroma occurs, whether we use drains or don't use drains, how do you handle it? Are we draining it every week? Do you go in and sometimes, I let me back up. You asked the question, how do you handle seroma? And it can be handled a couple of ways. I'll give you my experience. I've handled it multiple ways. It just depends on the relentlessness of the seroma. If we're able to drain it a couple times in the office, get you in a good tighter compression, limit your activity, and uh, you're religious about that post-operative care, then we can eliminate a seroma. That's one way to do it. I've actually had seromas where we've drained it a couple times in the office and maybe that's not working. Then I will maybe send you to an outpatient radiology center or a hospital and have a drain placed under ultrasound where they can drain the fluid, they can leave the drain in, they can even do tests on it and make sure it's not infected. So I may do that, and I've done that before. In seromas or fluid collections that just won't go away, whether we've drained in the office multiple times, put in a catheter or a drain under ultrasound, and it still drains, we may need to either one, go in and remove that scar tissue that's formed around it to seal it off, and then use PTS, progressive tension sutures, in that area along with the drain, or we may decide to still go a non-surgical route, but be very aggressive by injecting agents underneath the skin to create a really rough kind of inflammation or inflammatory event to help kind of scar that space close. In the olden days, we would use tetracycline. So it's an antibiotic, and we would inject that underneath the skin to kind of help that. There are various other medications that you can use now. It is completely, utterly uncomfortable. So try not to go that route. I'm almost rather go the surgery route versus doing that, but that's a way to manage it. And I've done that before, but a million years ago. As if as with any particular procedure, an ounce of prevention is worth a pound of cure. So drain for me. I'm most likely always going to use a drain. I may use progressive tension sutures plus that, but rarely, if ever. I'm not saying never, but if ever, I only use progressive tension sutures. So I rarely do drainless tummy tuck. There are a lot of my colleagues in town that do drainless tummy tucks, and that's fine. I just know what works well in my hands for my clients, and that's the key. Making sure that you have a plastic surgeon, not a cosmetic surgeon, a plastic surgeon who's trained, who's been tested or vetted through the certification process by the American Board of Plastic Surgery to make the best decision for your particular situation. So, if you want a confident contoured waist safely, your plan should be a personalized plan. Again, I tailor tummy tucks to using drains and hybrid techniques occasionally if it makes sense. A drainless tummy tuck can be utilized for my clients, but again, the safest outcome is always where we're going to go. If you're interested in that, this appeals to you, then it's very simple to book a consult with me. You just simply pick up the phone. You call 770-466-4700, and we will get you scheduled for an in-person consultation. That's our preference. But if you're out of town, I work with out-of-town patients from coast to coast. We can first get you set up with a virtual consultation, and then we can move you forward. If you're ready and you're a candidate and you like our plan, then we'll get you in before the procedure, and we'll do a in-person consultation. Our consultations, in person or virtual, are $225. That fee is applied to your surgery if you decide to move forward. If you're not quite ready, go to my website. I think it's a wealth of information. So go look at that, and you can look at tummy tuck and other procedures that we perform, such as facelift, eyelid surgery, uh, chin surgery, genioplasty. I do revision surgery for clients that had surgery elsewhere that didn't work out. I do that as well. So go to my website here, listed, and check me out. And hopefully eventually you'll call the office and we will be happy to meet with you to help you get to where you want to go. Again, this is ESJ Aesthetics. I'm Dr. Earl Stephenson Jr. This is where confidence takes shape. And I appreciate your time. I hope you enjoy your weekend. And until next time, peace.